A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. Mental illnesses are among the most common health conditions in the United States. According to the Center for Disease Control, more than 1 in 5 U.S. adults live with a mental illness. Over 1 in 5 youth ages 13 to 18, either currently or at some point during their life, have had a serious, debilitating mental concern. And about 1 in 25 U.S. adults lives with a serious mental illness such as schizophrenia, bipolar disorder, and major depression. What causes this? And if you or a loved one suffers from a mental health concern, where can you go for help? Find out on this special edition of your Hometown Health Connection. I'm John DeSciullo. Welcome to your Hometown Health Connection, where we will tackle the issue of mental health and how Spectrum Health and Human Services offers help to anyone who needs it. Let's meet our guests. Robert Cannata is Senior Vice President of Business Development and Community Crisis Services. A graduate of SUNY Buffalo State University, Bob began his career at Crisis Services as an outreach worker, where he worked helping people in need at their darkest hours. After 4 years, he joined Spectrum Health as a counselor and steadily advanced with the agency over the next 7 years. He was recruited for a management position at the Buffalo Federation of Neighborhood Centers and returned to Spectrum Health in 2017. He oversees all emergency services for the agency, including Spectrum Health Cares, a 24/7 response program for youth and families in crisis that serves several counties in Western New York. And in addition, Bob is an active member of the Suicide Prevention Coalition of Erie County. Our next guest is Mackenzie Gullo, substance abuse counselor, a BA in mental health, assisting in psychology, currently enrolled in a Master's of Social Work program at Rutgers University, has been with Spectrum Health since 2021. She's completed an internship with the Renaissance House in 2020 and in 2021. And we welcome you both to your Hometown Health Connection.
Thanks, John. Good to be here.
Good to see you again, Bob. Bob, talk to me about Spectrum Health and Human Services. What is the mission of the agency?
Spectrum started as a small non-for-profit in the South Towns back about 51 years ago. Started out with doing mental health and substance use counseling in that area. And then over the years, we've really strived to put our services wherever people wanted us. So now we've gone from that small organization providing mental health and substance use to now we're in Genesee, Orleans, Wyoming, Monroe, Erie, Niagara, and Cattaraugus counties. So we have clinics in these different locations, case management, peer support services. We have an assertiveness community treatment team for people that are more involved. Of course, our cares and our mobile crisis that I'll talk about in a bit, and several other kinds of housing and all different kinds of programs as needed by the community.
Very important services for all of Western New York. To explain a mental health crisis, how does that get to be given the term for a human being that's involved with a mental health issue? When does it become a crisis?
Yeah, it becomes a crisis when whatever the usual way is that individuals and families are responding to a situation doesn't work. Something escalates, something comes in as a surprise. It could be like a first time kind of a situation where people are just completely overwhelmed. It could be mental health symptoms, depression, anxiety, substance use. Could be feelings of suicidal ideation or wanting to hurt other people. It could be all of those things, but the difference that makes it a crisis is however they coped before isn't working. So they need something from the outside, and that's where Spectrum Health comes in.
And that's where, Mackenzie, you come in too, because you're now dealing with somebody that comes in for counseling. How do you interact with somebody when they come in seeking help?
So every situation's different. Sometimes we get referrals from, right out of the hospital, if they were there for a psychiatric evaluation. Sometimes we get some of our referrals from cares and from crisis services. Sometimes our current clients contact clinic and tell us that they're in crisis and they need to talk. And so hopefully we're able to get a clinician, whether it's their primary clinician or someone else that's just available on the phone. We also have other staff on site that can also kind of intervene during that crisis. If nobody's available to take that call, we do transfer to cares and kind of let cares take over and then reach out when it becomes appropriate to. We'll coordinate with CARES. We're all in the same umbrella, so we all can communicate through email really easily. And there's like a continuum of care. There's so many different,
Well, it seems like there's a lot of touch points for that individual that's coming in. And probably the most important part is when you or the other counselors connect with that individual, maybe for the first time, to hear their story and offer that assistance. And then it goes from there.
Yeah, so a lot of the time, we aren't always the first person the client speaks with when they contact our company, right? Like they'll talk to an intake counselor and they'll schedule the intake, and then they'll meet with us. And you're right, we're the first person they're meeting and interacting with and kind of telling their story to. And it's important for us to be warming and like welcoming and like kind of reiterating that it's a safe place for that person to talk about what's going on. And we try to get an understanding of why they're seeking services.
And I would think, Bob, over the years, in the many years that you've been involved in mental health and helping people, that first touch point is very important because it might be many months, years before that person would have maybe even made that decision to seek counseling. So you want them to feel welcome.
It's so critical. You know, I always look at it as a continuum of services. So, you know, when you think about in the community at large, you focus on wellness to keep people from having to experience a crisis. But then the next part would be if there are problems, they can meet somebody in a clinic, they can come into Spectrum. And then kind of like if you look at it as green, yellow, red, red is like, uh-oh, I need a response right away. And at any point, it has to be an interaction where you can quickly establish some kind of rapport and have the person believe that they've called or they've come into the right place. So that's what we're all about. We strive for that at Spectrum.
Yeah,
it's not easy.
No, not easy, but a great team approach, and you're dedicated. You're very dedicated, and I'm sure all your teams are. Bob, when somebody comes in to seek help, sometimes they come in because they maybe have gotten in trouble with the law or they may have done something that's untoward. Talk to me about how law enforcement now has become more sensitive to mental health issues with the various police agencies that are in Western New York, and how that factors into what you do at Spectrum.
Sure. Yeah, over the years, I think the police have realized that they can't just approach it as police officers, that they have to look at every situation with compassion, with empathy, all those things that they're not really trained in to begin with in terms of taking control and handling this situation. So the police over the past 40 years that I've been involved in this have really wanted to learn more themselves, but they also recognize their limits too, and they say we want to be able to work with teams when we need to. So for instance, when I talk about like our CARES team, now CARES stands for Crisis and Restabilization Emergency Services. So the CARES team, if they go out, especially if they're seeing someone under 18, a youth anywhere in Erie County, we'll call the police if it's a situation that we need some kind of backup to ensure our safety or the safety of the people that we're going to see. Mobile crisis counselors don't carry any firearms. They don't have any, they can't put their hands on anybody, restrain anybody. So if there's a situation like that, we'll get law enforcement involved to protect our safety. At the same time, we work both ways. Sometimes they'll call us out and say, you know, we're looking at something, we're not sure what to make of it. Can you come out and assist us? And we do that in Orleans, Genesee, Wyoming County, and Erie.
Yeah, it's very important to note, and we'll get into that later in the show, the differences between the urban and the rural communities.
Sure.
We talked before we came on the air, Mackenzie, about the law enforcement again, and how sometimes somebody who's in crisis and dealing with an issue could become very intimidated if they see somebody in a uniform approach them as opposed to a counselor. So that's a very important dynamic, isn't it?
Yeah, absolutely. I think that right now is a difficult time for those in law enforcement already with, I guess, like the climate of the world. And I think it's also a difficult time for our patients of color. And that is what I have noticed is that, like, when I've had a client in crisis at clinic, like an already established client, I'm trying to de-escalate at clinic on my own. whether I'm grabbing another clinician or somebody from our leadership team to come in and help, I'm trying to de-escalate without having to call, law enforcement, because I don't want to escalate the situation even further and like worsen the anxiety.
Yeah.
So I try to approach it, with a trauma-informed approach and making like the best decision for that client prior to making that phone call.
A lot to process in a short period of time.
Yeah.
You mentioned intake. How long before maybe that person that makes the call, who's in crisis, makes that call, connects, and then sees you? What's that time frame?
So somebody that's in crisis can actually walk into any of our outpatient clinics and do what we call a walk-in intake. They can come in at any time and explain that they're in crisis and that they need help, and a clinician will become available almost immediately to assess their situation, assess if they're high risk, see if there's substance use involved, and then get them scheduled for a follow-up appointment, typically within the first week of that first appointment. If they are coming from a hospital discharge, we see them within 7 days. I believe we have a specific intake slot that's reserved only for individuals who are coming out of the hospital. I'm not sure I think it's similar with the CARES referrals, but I'm not sure. I don't know if you know more, Bob, sorry.
Mm-hmm. Well, the priority would be whatever the level of the crisis is. If someone needs to be seen right away, we're going to figure out a way to see them, whether we come out to see them or they come in and see Mackenzie or someone else.
So it could be you go to the individual to see them, or they come in to see you. And those clinicians are trained in many different aspects of mental health and also in substance abuse, because they may be dealing with somebody who's abusing and they're acting out as a result.
Yeah. I think I would say that every clinician at Spectrum is trained to be able to deal with a crisis situation, with especially lethality assessments, and all of the Spectrum employees, whether they're clinicians or not, are trained also to recognize this is a crisis beyond me. And then they can get like a team like ours involved. The difference with the mobile crisis teams, if I were to kind of differentiate between that and other kinds of counseling, it really takes like a special person that's willing to drop everything, go out to someone's house with a partner, we operate in teams of 2, and be able to quickly make sense of a situation. So you're in a brand new environment, tempers are flaring at times, everybody's in crisis, and those counselors have to be very good at establishing rapport, getting in the door, separating people sometimes if needed, making an assessment, looking at risks and also supports, and then coming up with a good plan before they leave.
Yeah.
So that's it's a whole different it's kind of like any kind of a counselor, except you have to really think quickly and be willing to take that on.
Right, which is why the training comes in, because they go through those various scenarios. What other kinds of services are offered at Spectrum when it comes to counseling?
Yeah, so our outpatient center offers a wide variety of services. Individual counseling is probably the most common service people receive. We also offer group counseling. So we have a mental health group running right now, and we have several substance abuse groups running as well. And that's where clients are. It's a peer-based group. So there's 6 or 8 patients in a room, and they're receiving group therapy. We offer psych rehab services, which is, I think we renamed it wellness services actually right now. And they are somebody that can help with skill building, connecting that person to other resources in the community. If they're higher risk and their primary clinician doesn't have the ability to see them on a weekly basis, that's a really good service for us to utilize for that week where maybe we have to go 2 weeks without seeing that client, and they can see them on that off week, and then we see them the following week. We also offer targeted case management, and that helps clients get connected with things like Medicaid, other health insurance, food stamps, other benefits that they might qualify for. We have psychiatric management services as well for med management. Individuals can come through and have a psychiatric evaluation with one of our nurse practitioners or our doctor, and receive medications. We have nurses on staff as well for health monitoring. We're kind of like a one-stop shop.
You are. Yeah, Spectrum Health is terrific. And we're going to learn more about youth in mental health when we come back after this break. But here's some information that you'll need to know if you've been watching and you think that you have an issue or a friend or a loved one. Here's the website, shswny.org, and the phone number that's on the screen, 716-710-5172. We'll take a short break, but listen to this special message from Spectrum. And as I said, when we return, we'll talk about mental health in young people. Stay with us.
If you're concerned that a youth under 18 may have a serious behavioral, emotional, or addiction problem, call Spectrum Cares, 716-882-HELP. Spectrum Health and Human Services. Help now, 24 hours, 7 days. 882-HELP.
Welcome back to our special edition of your Hometown Health Connection. We're talking about mental health with our guests from Spectrum Health and Human Services, Robert Cannata and Mackenzie Gullo. Bob, let's talk about youth and mental health and how prevalent is our mental health issues with young people, and how do you handle that?
Well, our CARES team, the 24/7 service in Erie County for kids, is for any child, any youth under 18 years old in Erie County. And that program, I think we're in our 15th year of delivering that service. So definitely prevalent. One of the ways I would say, like, the differences with mental health crises with small children versus teens versus adults, they show in different ways. Young kids talking about wanting to die, a 5-year-old saying that is different than like a 10-year-old, a 15-year-old, or an adult. And so the counselors that come out have to really be trained about developmental stages and realize there's some kids that, again, another example, a 6-year-old throwing things around is different than a 15-year-old throwing things around, is different than an adult. So we have to be able to kind of differentiate. The problems they have, for a lot of the kids, I think of it as possessions and permissions. It's possessions, the arguments, the parent-child conflicts are about, I want to play my video game, I want to watch TV, I want my computer, I want my phone, those kinds of things. And permissions, I want to stay out later, I want to hang out with this person, I want to go there. So a lot of times, like the kids, whether they're really young or teenagers, will get called out because they're acting out in the parents', in the parents' view, and they'll want us to come out. Sometimes they want us to take the child to the hospital, often against their will, and that would be a last resort.
That seems pretty severe.
Yeah, we have authority to do that. We have licensed counselors that can do that, that can sign the papers under mental hygiene law to have somebody brought to the hospital against their will. But that's not that's not an admission. That's to be evaluated. And again, a last resort.
It seems like there's issues of discipline versus some maybe mental health issues, trying to make the distinction between the two. And how important, when you talk about the parents, that the parents step up and say, my child has some issues, not so much disciplinary issues, but mental health issues.
Sure. And and I like to think that the stigma is reduced over the years, and that there's a lot of parents that'll say, this is okay, I've gotten services myself, and now I need them for my child. But it's still, sometimes it becomes like a, parent puts it on the child blames the parent, and then, again, the best clinicians are going to be able to go out, kind of sort things out, offer reasonable solutions, and then, again, it could be a referral to a Spectrum clinic or another clinic.
Right.
It could be hospital, but it can also be like putting other supports in play.
Very important, that word stigma. In the years that you've been involved in this industry, Bob, and it's been a number of years, and thank you for your service. I think we're finally at that point, don't you agree, where that the stigma of saying I've got a mental health issue or I've got a family member is really starting to fade away. Thank God.
Yeah, I really think it is. I think the key part is starting to fade away. It's still there, but I'm always so impressed with the people I meet, like even colleagues that say, psychiatrists that go on record of saying, I have a bipolar disorder, I'm on medication. Counselors, other people have said, I've gone through this myself. So I think that's one of the first steps, to normalize it and realize, for me, it's always on a continuum. Nobody is 100% perfect mental health all the time. We're all on that continuum at some point. Some people are maybe further along on the seriousness more of the time, but we're all there.
And let's talk about peers, people that connect with others. How important, you talked about in the previous segment about people of color, perhaps connecting with a counselor or a peer who's a person of color to feel more connected. How important is that peer group, and what does that mean?
So I think that our peer services are really important. A peer in clinic is a clinical position that gives them the ability to go out into the community. They aren't practicing as a counselor per se. They're acting as a peer to the client. They have themselves experienced mental health or substance use in their life in some shape or form, and they are using their own experience, strength, and hope to serve the client. And you know, they go out in the public, they can go get coffee, they can go to the gym, they can, you know, go shopping, they can you know, go to a 12-step meeting if it's for like substance use. They can do so much more that like we as clinicians can't. If my client came to me and told me that you know, they were starving and they had no food in their fridge, ethically I cannot give them that food. I can give them resources to the food pantry. I can tell them who to call. That peer can bring them out to lunch. That peer can bring them you know, something to eat. That peer can help on a level that we aren't really allowed to because of our clinical position.
The peer can really act as a person that says, if I can do it, you can do it too.
Yeah.
Bob, let's talk a little bit about the city versus the suburbs. You know, we have the city of Buffalo, the city of Niagara Falls, and other cities in our Western New York area. But what's the difference between handling concerns, mental health concerns, in the city versus a rural area or a suburban area?
A couple things come to mind. The first thing I think of is just that when you start going into the rural areas, a lot of times it's distance, it's transportation, it's about, can you send a team out in the middle of a blizzard, you know, covering, you know, miles and miles. So I always think of the logistics in that. Being able to respond, it's harder to respond the more rural the area gets. The rural areas, especially I think of like Wyoming County, where we do a lot of work with adults and kids, CARES goes out there, very few resources. So you really have to mobilize the resources you have to do the best job. Right. And I was thinking, one of the things that happens in the rural areas is the police seem to kind of be more involved in the community. So there's times where we go out and see somebody and the police pull us aside and say, hey, we know Joe. We've been out here 4 or 5 times. Let's give you some information. You know, so there's that. The other thing is the prevalence of firearms. The more rural the community gets, we have more households that have firearms. So we have to consider, again, we're sending a team of 2 counselors out in an unknown environment, and they have to be able to look at like what are the safety issues. So there's, you know, and I say that kind of like, so that might be the extreme of the most rural area. The suburbs, we tend to get police and ambulance quicker in the suburbs in some of them. And I think part of that is they have a smaller area. Buffalo has their hands full in what they're covering. But whether it's suburb, rural, or city, we're going to do our best to get out there as much as we can, as fast as we can. And
people are needed to do this. And you're very young, Mackenzie, to have gotten into this. And to me, it's like a calling in some measure. Are there enough people out there to meet the needs of the public that needs the help?
I think that there is a booming field for mental health professionals. Right now our clinic's fully staffed and it's great. We're operating really well, and we have a great team right now. But I know it's not like that everywhere, and not only at Spectrum, at other agencies. I know that it's hard to fill those spots sometimes. I think that there's going to be more and more mental health jobs available as like the years go on, if that makes sense.
Yes, absolutely. In many different ways.
It's a good field to get into. Yeah. It's, 95% of us don't get into this for the money, It is. It's a calling. It's a helping profession. It's something that you have to be passionate, compassionate, and like have empathy for people to be in,
Absolutely, and you do too, Bob, and your teams do at Spectrum Health. And we talked a little bit about the pandemic. You had your baby during the pandemic, so many things changed during COVID. And Bob and Mackenzie, I'll throw this out to both of you. The online portals that are now available, telehealth, versus that in-person connection. Some people can say, well, it gives you an opportunity to connect, but at the same time, you're losing that interpersonal communication. What are your thoughts on it? Bob, we'll start with you.
You know, just a quick thought. I mean, I really love the part that at Spectrum Health, we really try to make sure we accommodate whatever the individual needs or wants are. So if somebody says, you know, I'm going to risk it, or I'm going to take that step and go into a clinic, that's great. But there's also people that might want to talk over the phone. They also might want to do the telehealth kind of thing because they might feel more comfortable. But I mean, I'm not a fan of strictly telehealth. I know it has its place, but at some point you need to be able to feel like you need to be able to sit across from somebody and
you have
and
the
help
same
them out.
feeling, I think, too. Mackenzie.
Yeah, I do. I think that it takes away the therapeutic relationship that happens between a client and the counselor. I think it's very different. The way that like I interact with a new client over telehealth is going to be so much different than if they're coming into my office. I know you've never been in my office, Bob, but like I have a pretty cool office. It feels very homey. It doesn't feel like a counselor's office. It doesn't feel like a doctor's office. When I'm doing telehealth, a client only sees whatever wall is behind me.
Right.
They're not seeing that there's a table full of candy or sensory toys, or there's coloring books, or like various different things to make them feel comfortable, and they're not getting that part. So I think it takes away from that. I think it's beneficial for some, but not for all.
We have about a minute left in the conversation, but COVID itself, I think, must have changed a little bit too, the dynamic of mental health, because people were confined, they weren't getting out, and that, from what I remember, called a lot of attention to that situation as well.
Yeah, absolutely. I know I was just speaking with my supervisor that like during COVID, we saw a huge increase in people looking for mental health services. And when we went back to primarily face-to-face appointments, a lot of those people decided to disengage. Maybe that was to go to a telehealth provider. I don't know. But we've seen an increase again in substance use clients. So I think that a lot of people were brought to the field and sought help during COVID because it was all over the news. It was talked about.
Yeah, it was a time that changed the world.
Yeah.
And well, I want to thank you both for being here. Bob Cannata and Mackenzie Gullo from Spectrum Health. Thank you both for being here and being a part of our special Hometown Health edition. We want to make mention that Spectrum Health and Human Services has some important phone numbers and websites, and we're going to give those to you in just a little bit. But before we go, Bob, I wanted to talk about an event. Mental health and first responders and crisis outreach workers are going to have a night of music to honor health outreach workers who respond to crisis situations. That's Wednesday, May 22nd. Tell us a little bit about the event.
Yeah, it's really a nice idea. I have to credit Bob James from Western New York Vets and other folks connected with him decided to put this on for us, and it benefits crisis services, outreach workers, and our care staff. So it's going to be a really nice event. They have a number of bands that are going to play.
Big-time musicians, George Paleo, Dick Bowerly, Patty Parks, who I've seen perform, Gretchen Schultz. You have
we've got some great people.
And more than that, too. So it's at the Cave, 71 Military Road in Buffalo, $10 at the door. And the information is on the website that we're going to show you in just a little bit. So make sure you get out to the Cave on Wednesday, May 22nd. Doors open at 6 and music at 7. And support those hometown heroes, right?
Absolutely.
Yeah.
Absolutely. Thank you.
If you would like to reach out to Spectrum Health and Human Services, here's that information. The website, shswny.org, and the phone number, get a pen and paper, write this down, 716-710-5172. Thanks for joining us on this special edition of your Hometown Health Connection, presented by Buffalo Healthy Living Magazine. Be safe and be well. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.